Hey, one last sound check.
Can you hear me?
I can hear you.
Thank you.
Got a guy coming to slip plow where the tree rows are gonna go next week or so.
Nice.
Get that done and then it's hard not to go, hard to go back to trees when the corn and the silage are just as good as trees were. And no wait. I could,
Fill out which portion.
I could
Give me
order
the
it,
information.
plant it here in about 6 weeks for silage. For
Carrie
job.
Davis, she didn't check which one she. Are you speaking under unscheduled? The only time that testimony will be taken today is under unscheduled unless you're the appellant for Kingsview. So anyone who's here to speak on a Kingsview item, it needs to be unscheduled unless you're the appellant. Okay.
I want to speak in public comment.
Alice, for this item? Okay. Yes, the only time we're taking testimony. Alice, you did have it checked, but I saw that you wrote, so I checked it too.
Okay, for Alfred.
Alfred, I checked you for unscheduled. Are you here to talk about the case as well? Yes. Thank you.
Okay, Catherine, are we ready?
Just a moment. I'm trying to get together all of the speaker cards I have.
Okay.
Oh, thank you so much. Darrell, if you're going to speak under unscheduled, you're wanting to speak during the item. Okay, that's what I thought that's where I was putting it. Thank you. Ready? I got them. I'm sure there'll be more. Yes, it does.
Catherine, you'll let me know when you're ready. Can you hear me?
And tell them we're ready to go.
Mr. Chairman, we're ready.
Okay, you can hear me okay?
Yep.
Okay, very good. All right, well, good morning. Today is Tuesday, September 14th, 2021, and this is a regularly scheduled meeting of the Kings County Board of Supervisors. Due to issues arising from COVID-19, the board is using a WebEx teleconferencing format.
Just a moment, Craig. We're having a hard time hearing you. Can you just give us a moment? We're going to turn up the volume.
Okay. Let me, I'll switch here. How about now?
Okay. Okay, go ahead.
Okay, we'll start over here. Good morning. Today is Tuesday, September 14th, 2021, and this is a regularly scheduled meeting of the Kings County Board of Supervisors. Due to issues arising from COVID-19, the board is using a WebEx teleconferencing format for today's meeting and may be participating via the World Wide Web. If you'd like to make a comment through the teleconferencing format, please make sure you are identified by name in the WebEx system. For those interested in commenting during unscheduled appearances at 9 a.m., please use the raise your hand feature and wait to be recognized. You will be allowed up to 2 minutes for public comment. Any person in the audience who either in person or online wishes to speak regarding the administrative hearing today, and again, this is the administrative hearing, you must do so under unscheduled appearances as there will be no testimony taken during the hearing. Members in the audience who have filled out speaker cards will be taken in the order they were received by the clerk, and online speakers will be taken in the order they appear in the WebEx program showing their hand is up. Please wait to be recognized. Your name will be announced. Then it will be your turn to speak. If you wish to speak today and are having issues with the raise your hand feature in WebEx, physically raise your hand so that we may see you and then wait to be recognized. Each vote today will be a verbal or voice vote so that members of the public can hear how each board member has voted. After we have had a motion and a second regarding each item we are taking up today, there will be a roll call vote by district. Madam Clerk, would you please call the roll?
Joe Nevs,
Here.
Richard Valley,
Here.
Doug Verboon,
Here.
Craig Peterson,
Here.
Richard Fagundes.
Here.
Okay, we have 5 present. We'll move forward with meeting. At this time, we'll move to the invocation. We'll ask Pastor Brian Kleinheimer of the Koinonia Church to please do so. Good morning.
Good morning. Let's pray. Father God, in this time of fear, with needs not being met and so many people getting sick, you do not change. You are still with us and still for us no matter what happens or what we do. Father God, thank you for the leadership of the city and for the county, for putting in the right people at the right place at the right time. And for this, we thank you in Jesus' name. Amen.
Amen. Thank you. Would you all please rise and join me in the flag salute? Ready, salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Supervisor Verboon, could you close the door for me? Thank you.
Okay, at this time, we'll move to item 2, which is unscheduled appearances. Any person may directly address the board at this time on any item on the agenda or other items of interest to the public that is within the subject matter jurisdiction of the board. 2 minutes are allowed for each item. And again, I'll remind those that are attending today, if you wish to speak on the hearing agenda item, this is your time to do so. We will not be taking public comment on that item during the period of time which we have scheduled for that item. So, Madam Clerk, would you please go ahead?
Yes, Mr. Chairman, this is Catherine Venturella, Clerk to the Board of Supervisors. My first order of business is to let you know the list of letters that we have received. All of the board has received copies of those either in hard copy or electronic this morning, and they will all become part of the permanent record. The names of the persons who submitted letters were Julie Calkins, Cindy Fagundes, Jack Mungu, Tim Harper, Mary Beth Wynn, Community Behavioral Health Center, signed by Bojas, Carmanlian, I apologize, Tom Ellsworth, Lisa Knoll. And then I also have a letter from Kathy Gwynn, Bill Dollar, Myra Alvarez, Lisa Zapata, Christina Falsuk, and all of those will become part of the permanent record. I also have 19 speaker cards, if you would like me to go ahead and start.
Sure, please go
The
ahead.
first one is Rohina Fazil. Hope I said that right. Apologize.
You said that perfectly. Thank you. Good morning. My name is Rahina Fazil, and I'm Vice President at Mental Health System. And I'm here to speak against the appeal to award MHS the contract for children's mental health services. I just want to say a little bit about the vision that MHS wants to bring to this county in providing these services for children, vulnerable children that need the services. We really spent a lot of time thinking about the approach to provide services that cover gaps for children in this county, and we want to be invested in being partners with the county. We're very excited and delighted that we were successful in our proposal, but we wanted you to hear a little bit about what the vision is for MHS. We want to try to provide innovative approaches to provide outreach, reach the communities that don't have access to mental health, bring in bilingual, bicultural staff members here. We are an agency that's really experienced in community-based services. So we want to go out and meet clients in the community, in the schools, with the families. But I'm really excited to share that we're bringing in some models that I think would be really helpful to the children and the families here. We understand that there's a portion of those kids that are between 0 to 5 ages, and some of the models that we're bringing in have a lot of evidence behind them, and they're really effective, such as CPP, which is a child parent psychotherapy model. In addition to that, we have advocacy and outreach and innovative approaches that we think could really service the children and families here. And so we'd like to be given an opportunity to do that. Thank you so much.
Thank you.
Next up, we have Sylvia Reed Drake.
Good morning. My name is Sylvia Reed Drake. I'm the Senior Vice President and a member of the executive team with Mental Health Systems. Our CEO had planned to be here today, but due to the social distancing requirements, he will join us virtually along with the COO. I'm here today to speak against the appeal to award Mental Health Systems the Children's Services contract. I want to tell you a little bit about who we are. We've been doing behavioral health services for 43 years. We're contracted in 10 counties. We have over 1,000 employees working for us. We also provide services to children, adults, and families in California. And we have thousands of services that's being provided. We have mental health programs for children throughout these counties. We've also provided similar services in Fresno County with twice as many children and families. We are invested in the Central Valley region. We provide services in Kings, Kearns, Tulare, and Fresno County. We are excited about this opportunity to have the Children's Specialty Mental Health Services contract. In regards to continuity of care, we do this. We've been doing it for many years. We know how. We know the importance of continuity of care. We build strong partnerships in the community, and we have strong partnerships in the community. We understand the success for transition and making it successful for families and children. We are your Kings County Act program and have been for the last 3 years. We have implemented master leases to stabilize our clients. We are excited about the success of our proposal, but with respect, the decision that's made here today will carry a message to all providers such as us. I want to thank you for your time and your consideration.
Thank you.
Next up, we have Nora Lynn.
Good morning.
Good morning.
My name is Nora Lynn, and I have lived in and owned property in Lemoore and Kings County for 25 years. My 2 children attended school in Lemoore K through 12 and community college at West Hills. My son is currently serving in the Air Force and was recently working with Afghan refugees in Qatar. While living in Kings County, I completed a master's degree in counseling at Fresno State and was hired by Kingsview into the Children's Services Department. I've been employed at Kingsview in Hanford for 14 years. I have provided therapy services to children and families in Hanford, Avenel, Corcoran, and Armona at clinics, schools, and family resource centers. I've served as Quality Management Director and Program Manager for the Access and Crisis Department. I'm currently Assistant Regional Clinical Director. Kings County Behavioral Health agreed to a scope of work and signed the 2020 to 2022 contract with Kingsview in the spring of 2021, which included children's services. About a month later, Kings County Behavioral Health put children's services out for RFP. Looking back on the RFP process, we were left to guess what KCBH wanted. Looking further back to the development of the scope of work for the contract, it is clear now that we guessed wrong about what KCBH would later require in the RFP. Because of the complete lack of transparency by denying our public information requests to review the rubric and scoring of the RFP process, we are still left guessing. I respectfully request that this appeal be continued and that the public information request be granted to provide for informed review of the RFP process, including further appeal if seen as necessary. Thank you for hearing my concerns.
Thank you.
Next, we have Carolina Davis.
Hi, good morning. I'm Carolina Davis, and I am the Children's Case Manager for Kingsview. I've been with them for 2.5 years, and I've lived in Armona for the last 5 years. So I'm here to support Kingsview and requesting that you guys look over the appeal process for us. As one who has been working with the community, I actually go out to the schools and I meet with the children, I meet with families in their homes. I provide services. I'm very well informed about what resources we have in here in Kings County. So for me today, I'm just here to speak for the kids. You know, my concern is the transition and them having to develop a new relationship with a new therapist or a new case manager that I believe probably will regress. And, you know, most of them, the comments that they have given me is, you know, not being able to work through what they've already worked through the past 2 years. And so the regression with their treatment, you know, completing their goals, having an agency that is not very aware of what resources are here, that's my concern with that. We build a really strong relationship with the schools, with the kids, with the families. You know, I go out to Avenel every Friday. I'm there from 8 to 4. I go to Corcoran every Wednesday. I'm in Lemoore every day, and Hanford too as well. So that's my biggest worry. So I wish that you guys could take the opportunity to review all of our concerns with that. Thank you.
Thank you.
Next, we have Tal Eastlick. Apologize if I said that wrong.
Good morning, everybody. It's good to see everybody. I'm working with Kingsview. My name is Tal Eslick with Vista Consulting, and I know we'll hear a lot during the hearing later this morning. Hopefully not this afternoon, later this morning. But I just want to sort of highlight the fact that Kingsview, as indicated in the name, is Kings County, and we brought a number of folks here this morning that are not only members of the Kingsview team and very committed to their work and obviously very talented at what they do, but also their constituents of Kings County and of this Board of Supervisors. So I know that the hearing is an administrative process, and there's, you know, sort of issues related to the RFP, and that's important, and we should spend time on that. But again, just want to highlight the fact that beyond the lives of their patients, you've also got the lives of people who work with this program here in Kings County who live here. So thank you for your time and your attention on this, and look forward to your guys' engagement on the issue. Thank you.
Thank you.
Next is Beverly Rain.
Good morning. My name is Beverly Rain, and 40 years ago, I was the little exchange student at Hanford High, as you well remember, and Hanford took me under its wing, as did Kings County. I'm still here, Lee and Judy Lockhart were my parents, and Lee Lockhart encouraged me strongly to come to work at Kingsview. When I asked him why, he said it's a bloody good organization. Not only is it a good organization doing good work, but we've been here in Kings County for 57 years. My role at Kingsview, not Kings County, is the executive director of telepsychiatry. In that role, we have been doing telepsychiatry for 27 years. Continuity of care is critical, and I mean critical, especially in children. We see it. We've been doing it for 27 years. I implore you, please reconsider. Please think of Kingsview. We have been here 57 years. We've been culturally in this community and in this valley for over 70 years. It's a great organization. We do great work, and we have very dedicated people. Thank you.
Looks like we might have lost the chairman. Next, we have Alfred Trujillo.
Good morning. My name is Alfred Trujillo. I'm a Kings County resident. I've lived here in Hanford, California my whole life. I was an employee for Kingsview for 7 years, and I recently resigned because I opened up my own business. I am here to support Kingsview regarding the appeal for the Specialty Mental Health Services RFP. Kingsview has had a long-standing community partnership with Kings County for over 50
Yeah,
years.
we're cutting in and out a little bit.
Can you hear me? Okay. Go ahead. I am here as a concerned citizen. As a previous consumer of youth services with Kingsview, I started with Kingsview as a child, and the services I received from Kingsview helped me learn not only about my mental illness, but how to control it. My experiences with Kingsview made me want to help others in my community, which led me to volunteering in high school at Kingsview, and then getting a job with Kingsview as a peer support, allowing me to support others going through similar symptoms and experiences as me. I was then able to move up into case manager role, helping people, including youth, get into the same services that helped me. I have worked with parents and youth and watched the difference Kingsview Services has made in these people's lives. I speak not only as a prior employee, but as a member of Kings County and as someone who suffers from mental illness. The skills that I learned as a kid and youth at Kingsview has helped me get to where I am today. I was able to excel as an employee for Kingsview, share my experiences, advocate for others like me through various communities throughout the county, and now I own my own business here in Kings County. I hope that you consider reevaluating the RFP process and the support support Kingsview in continuing the work they do with children every day, especially during the difficult times. Thank you.
Thank you. Next, we have Alice Parrish.
See if you can hear me. Good morning. My name is Alice Parrish. I'm a Kings County resident. I live in Hanford. I'm an employee of Kingsview for 32 years. I'm here to support Kingsview regarding the appeal for the Specialty Mental Health Services RFP. Kingsview has a long-standing community partnership with Kings County for over 58 years. I am here as a parent of an adult who has received children's services and currently receiving adult services with Kingsview. My son started services in 3rd grade. He is now 29 years old. I am here to support the Children's Service Program, who has helped me as a parent all these years. They have supported and educated me when I was overwhelmed with the process of IEPs, daily behavior issues at Shelley Beard School, and TBS services. My son was very close of being put in a group home, but I knew in my heart he deserved better. I fought and advocated for his services and treatment. If it wasn't for the children's services, my son would not be the person he is today. He continues to struggle in this day. He has come a long way and has learned coping skills to manage his illness. I, as a resident of the community and involved in mental health services, I have seen many changes. Kingsview Services have been here for years and have provided great services for children. Their staff are well educated, caring, and compassionate. It is sad to hear that funding is being cut more and more, and the children of this community will suffer. Why change something that is not broke? Thank you.
Next, we have Lisa Rogers.
Good morning, Mr. Chair, members of the board. My name is Lisa Rogers. I'm currently the Regional Director over with Kingsview in Kings County. I'm speaking today not only as the Director of Kings County, but also as a concerned community member. I was born and raised here in Kings County. Hanford is not only my hometown, but it's my current residence. It's been an honor and a privilege to be in a role that allows me to make effective changes that benefit the community that made me who I am today. When it comes to mental health and the well-being of youth,
Not up, are you?
I'm not only
I'm going
invested.
in and out, in and out. It's a fucking mess.
Just a moment.
No bandwidth.
Craig, can you mute yourself until maybe you can get that to come back on?
Will do.
Thank you. Apologize. Go ahead.
Okay, so when it comes to the mental health and well-being of youth in this community, I'm not only invested professionally, but personally. I have a 2-month-old at home, a 10-year-old stepdaughter, and for the last 6 years, I've been coaching for varsity girls water polo at Sierra Pacific High School. All of those are ages that cross the spectrum of services that we provide at Kingsview. Over the last 3 years I've been in this role, we've become more involved with community and have built what I perceive as a positive working relationship with KCBH. Therefore, I stand before you today concerned with the changes ahead. Funding for mental health services at Kingsview have decreased significantly over the last 2 years, with no indication or discussion that those decreases were due to or related to our performance. In fact, at the March Kings County Advisory Board meeting, Kings County Behavioral Health gave a presentation about our recent remodeled building and was excited about the lobby that was created specifically for youth services. But now we are facing a change in service provider for youth without transparency as to why such a drastic change is needed. My concern is this: change for the sake of change isn't justification to uproot services that have been here for years, especially during a pandemic. I hope you consider a reevaluation of the RFP process and encourage transparency in the rubric scoring, which would allow contracted providers like Kingsview the opportunity to see if there's appropriate reason to appeal decisions based on the scoring given. Thank you so much for your consideration.
Okay, next we have Kelly Maestas.
Hi, good morning. My name is Kelly Maestas. I live in Hanford and Kings County and have been a resident for 16 years. I have been part of the Kingsview team for 3 years. I'm here to support Kingsview regarding the appeal for the Specialty Mental Health Services RFP. I've come to support Kingsview in their appeal not only as an employee, but as a resident of Kings County whose child received specialty mental health services with Kingsview during a very troubling time in his life. Reflecting on my son's services with Kingsview, as a parent, I know that the relationship and the trust that he developed with his treatment team played a tremendous role in his ability to manage his mental health symptoms. I strongly believe that disrupting the therapeutic relationship between my son and his service providers in the middle of treatment would have impeded his progress greatly. While thinking about the many stressors that the children in this community are facing right now due to the pandemic, I strongly believe that disrupting their services with their service providers that they've come to know and trust would be detrimental and only add additional stress to their lives. Knowing this, I ask you to put Kings County children first and not subject them to a disruption in their essential services. Thank you so much for your time and consideration.
Next is Ashley Ramstead.
Good morning, everyone. My name is Ashley Ramstad. I was born and raised in Hanford and I'm a current resident.
I'm a children's clinician. I specifically work with kids who are on probation. So I go out to all of their schools. That includes Avenel, Lemoore, and Corcoran to provide them services. I am here to respectfully voice my request to consider the appeal and to support Kingsview. I think that, as the other members have said, that a transition in services would be detrimental to our kids having to switch over to a different service provider, especially for our kids who have a trauma history and tend to take a while to warm up to their service provider. So I just want to respectfully request that the appeal be considered, and I thank you very much for your time.
Next is Angela Garcia.
Good morning, members of the board. My name is Angela Garcia. I live in Hanford in Kings County. I have been part of the Kingsview team for almost 5 years. I am here to support Kingsview regarding the appeal for the Specialty Mental Health Services Children's Services RFP. Kingsview has a long-standing community partnership with Kings County for over 58 years, and I ask that you put the children first in this decision. Thank you for hearing us today.
Next is Jason Williams.
All right, good morning. My name is Jason Williams. I'm a licensed marriage and family therapist, and I've lived in Hanford for the past 21 years. I'm here to support Kingsview in the appeal of the Specialty Mental Health Services for Children's RFP. For the last 4 years, I've been a member of the Kingsview Hanford Clinic, where we provide specialty mental health services to children and their families. Those familiar with children's mental health know that it doesn't just include the child. It includes families, schools, pediatricians, child welfare services, law enforcement, and the courts. Kingsview has 58 years of partnering with the community and other providers. Working with the crisis department has afforded me the perspective of understanding more about suicide among teens, self-injury, drug and alcohol abuse, and physically, emotionally abused children. This wouldn't be possible without having the children's psychiatry, clinicians, case managers, and supervisors to work with closely. Kingsview has 58 years of serving this population within Kings County, even treating those who transition to adult services and sometimes multiple generations. In my opinion, after providing 58 years of specialty mental health services, that would be a good indicator something is working. Our current times need cohesion, not further disruption leading to distress with our children in the community. As a parent of 4 children, husband, veteran, neighbor, and voter, please consider the RFP award. Please allow the children who need specialty mental health services to remain with Kingsview and allow future clients the opportunity to receive the same high standard of care that comes with 58 years of experience. Thank you.
Thank you. The next is Vera Diana Perez.
Good morning, everybody. My name is Rediana Perez. I am a caregiver for the in-home support services, and I'm just here to say if we can get some more help, because we are helping a lot of people with disability and also older individuals who don't have family to help them out. Our neighboring cities like Fresno, Tulare County, they all got a raise and they're all getting more help for caregivers to help out their clients. And I'm here to say we can get some extra help as well. Thank you.
Thank you. Next is Victoria Sanchez. Yes, you can. We do have a translator for her.
Good morning, soy Victoria Sánchez. Estamos aquí porque
Queremos hablar sobre el trabajo del cuidado de la casa, como mi hijo.
My name is Victoria Sanchez, and I'm here today to speak on the IHSS program.
Yo sé que en Fresno, en Tulare, ya les dieron, están ganando lo mismo que uno, y yo pienso que todos tenemos el mismo derecho. Es el mismo trabajo que estamos haciendo todos.
Yeah, she hears that in Fresno and Tulare County, they're getting different wages, and we feel we should be earning the same.
Y también aseguranza también, porque pues es un trabajo que uno ocupa también en ese trabajo, porque es un trabajo muy pesado.
And I also want to bring up health insurance. Health insurance is a benefit that we need because the work that we do is very heavy.
Thank you.
Gracias, thank you.
Next is Flora Valderinos.
Buenos días, mi nombre es Flora Valdovinos. Aquí estoy.
Good morning, my name is Flora Valdovinos.
Soy una trabajadora del programa IHSS. Estoy aquí porque sé que en otros condados están pagando más y tienen aseguranza, en lo cual en nuestro condado no lo hay hasta el momento.
Yes, I'm here today for the same reason. I hear that in other counties like Fresno and Tulare County, they're receiving higher wages and we are not here.
Y pues habemos algunos trabajadores que estamos de tiempo completo con nuestros padres, nuestros hijos, nuestros familiares más cercanos, en lo cual no podemos tener un trabajo fuera del hogar porque nos ocupa todo el tiempo con nuestro familiar.
Some of us are caring for our parents, for our kids, for disabled people, and we're there 24 hours a day, and we're unable to go look for another job with those type of benefits. So we really need them here.
Yo estoy trabajando con una persona que no es mi familiar, pero tengo varios conocidos que están en tiempo completo y pues creo que sería muy justo recibir el mismo trato, el mismo pago y la misma aseguranza, porque si no tenemos aseguranza en nuestra casa, o sea, si estamos trabajando con alguien que nos está ocupando todo el tiempo, no podemos salir a otro lugar donde nos estén pagando alguna aseguranza.
So me personally, I don't take care of a family member, but I do know of people that do take care of family members. And she's also mentioned that we're unable to go look for another job that does offer health insurance because our clients really, really need us.
Como decía, yo no estoy trabajando para alguien que sea mi familiar. Estoy trabajando por cariño, como quien dice, y pues también por pago, pero hay personas que tenemos algún familiar que de plano miramos que nada más nosotros podemos cuidarlo y darle la atención esa. Entonces, sería muy justo, creo que el pago.
And again, she mentioned she doesn't take care of a family member, but there's other people that do. And I think it would be just if we receive those benefits.
Muchas gracias.
Thank you very much.
Thank you. Next, we have Rose Kane.
Good morning. My name is Rose Kane. I was living here in Kings County for 25 years, and I am a foster parent for 18 years. And I'm here, and I'm a care provider for 3 years. And I'm here to speak about the same reason, like the other county, like they have different rates than us. So if we can be able to get the same rate that they have, and then the benefits also. And yeah, and I would like to thank for the Kingsview people, like helping for my kids for their mental health. And it means me a lot. That's all. Thank you.
Next up, we have Bill Shawhan. Did you want to speak on this part?
Morning. I know most of you. 47 years I've been here, and I'm a social worker. I have a degree in social work. I'm trying to help people be good at what they do. You provide services here, that's your responsibility. And I think with good employees, the better the employee, the better services you're going to provide for the public. And that's always been what drives us. I have people here today. For the first time in California that I'm aware of, we have a 4-year agreement. It is land shaking what it's going to do going into the future as to what we'll be able to do to encourage people to come here and to pay them what they deserve. And you've done a great job. Together, for the first time in years, we've worked together and come out with something that I can totally, absolutely support, and the employees are going to support. And I want to thank you very much for the work that you've done.
Thank you. Next, we have Ulysses Castellanos. That's for last.
Hello. So yeah, my name is Ulises Castellanos. I'm with SCIU 2015, and I just want to speak on behalf of the IHSS providers that couldn't be here today. The ones that spoke up today, they actually took time off from their clients' time where they provide care. So I just want to mention that IHSS providers do feel left out. They hear that Fresno IHSS providers have access to healthcare insurance. They have a better wage increase than us here. The same with Tulare, the same with Kern, with other surrounding counties. So I just want to mention that they feel left out, and they would really appreciate some type of support from the Kings County leaders, which you guys are. And another thing we want you guys to keep in mind is that we've been working through the pandemic. We never stayed at home. We had to go care for our clients. These elderly people can cook for themselves. They can go to the doctor's office by themselves. So a lot of our IHSS providers have been risking their lives in the front lines against COVID. And we don't feel the support here as other counties are supporting their IHSS providers. So we really ask you guys to consider that. And I have some handouts here, some information that might help you make that decision and invest more in the IHSS program and your caregivers in your county. Okay, thank you very much for your time. Board of Supervisors, thank you.
Ulysses, I'll take that and I'll go to the board. Thank you. And then I understand online Leticia Alanes would like to speak. I apologize if I said that wrong.
It's Alanis, thank you. Good morning, my name is Leticia Alanis, and I'm here as an employee of Kingsview and as a parent of a 9-year-old that receives counseling services. And with my experience as a parent, I see the struggle that kids go through not only in their lives, but during this pandemic. It takes time to establish services with the right provider, and when one is established, it's imperative to provide consistency and trust. I feel like it's a disservice to the children in this community to subject them to this type of change in the middle of any progress that they may be making. It's devastating not only to the children, but also to the families, to the employees as well. And it's also a really hard hit during this pandemic. I support Kingsview regarding the appeal and hope that hearing from the community and hearing how detrimental this decision is to the community will guide you in the right direction. And I hope that Kingsview, that you can put Kings County children first and not disrupt their essential care. Thank you.
That's all of the speaker cards and anyone online that I'm aware of. I do know that Kelly Vernon is in the audience who would like to speak.
Good morning, Mr. Chair, members of the board, Kelly Vernon, Chief Probation Officer. I just wanted to take a moment to remind you that we are having our groundbreaking ceremony tomorrow for our SB 81 project. We are very excited. This has been 7 years in the making. We can't wait to provide an updated facility for the youth that we serve. We are keeping with tradition somewhat and calling it the branch, but it will be the Behavioral Rehabilitation Academy New Chance Hub. So we will be able to consolidate all of our juvenile services in one location and have a facility that is up to date to provide services. So we welcome you all and we hope to see you tomorrow. Thank you.
There's someone with their hand up. I do believe there's someone that keeps raising their hand. Go ahead, David.
Hello, I'm David Rolfs. I've lived in Kings County since 1987 and worked with Kingsview since 90. And I just wanted to emphasize to the board that we've had in mental health services is a one-stop shop. That is someone that can start services with the children's services and then move to the adult treatment. I think that's very important. I think in our larger neighboring counties, when I try to line up services for example, Fresno County residents, everything is all disjointed. It's been very hard over the years to get them into the proper services, or sometimes even find a proper phone number because of the numerous changes of whether it's drug and alcohol or children's services or adult services. With this piecemeal approach that the other counties have used makes it very easy for our clients to fall through the cracks that are trying to get services. So I think the board should keep in mind that the less services are broken up, the better it is for our Kings County residents. Thank you very much.
Mr. Chairman, that's all that I'm aware of.
Okay, very good. And
Apologize, Ed would like to speak. You did tell me. Or Jim.
Jim.
I'm thinking of him.
He's not even gone and you already forgot his name.
Jim Erb, Director of Finance. I've only been here about 3 years, so she hasn't quite remembered my name.
I only see you once in a while.
I wanted to say a couple things. One is one other thing we're looking into, and I know I brought things to you that we're trying to clean up, and we've come across a discrepancy with our RDA distribution. It looks like it's minor, but it's complicated. So we're engaging HDL to take a look at it. Our property tax allocation person is pretty new now. And so we might have him look at some of our other distributions. It's a complicated spreadsheet. There's not many people in the state that even understand it. And so we managed to find someone. We're picking it up with our department budget right now, but at some point we may need to expand that a little bit. Last thing I want to say is goodbye. This will be my last board meeting. As you know, I started my accounting career when I was about 18 in Santa Barbara, and I put up notices in laundromats that I would do short form taxes for $4 and long form for $10. And I actually had a lot of people call me, and that's when I started. I'm ending my accounting career here in Kings County. I feel kind of lost, and I saw that you were interviewing for the Director of Finance, so I put in an application. But I missed the deadline and HR wouldn't extend it, so I guess I'm out. But I've enjoyed working here, and the Central Valley is where my home is now, and it's where we plan to stay. And I've liked working with all of the board members and the department heads and many of the staff that I've gotten to know. So I just want to say thank you for the opportunity to work here. I enjoyed myself. Thank you.
Thank you. Good, great job.
yeah, I would agree, Jim. Thank you for coming in, and I mean the policies and kind of guidelines that you've provided are going to be really helpful, and are going to be so important to Kings County in the future with its economic health, and so thank you for coming in and giving it your all for those 3 years. We really appreciate it.
Mr. Chairman, if I may.
Yes, sir.
Go ahead, Supervisor Valley.
Oh, I'm sorry. Thank you, Mr. Chairman. I'm away right now on a family vacation. My intention was to come on here and stay on as long as I can before I have to go. The unscheduled appearances pushed back the timelines for the Kingsview agenda items. So I just want to let you know I may not be able to stay on that long. And as long as you're fine with taking up that decision with 4 board members, I just want to give you a heads up so you can make a decision on either moving forward today or possibly moving it to next week's agenda. Totally up to you, Mr. Chairman, but I just want to give you a heads up.
Yep. yeah, I think we've prepared for all the options, and but appreciate the notification and thank you for that. Okay. All right.
Mr. Chairman.
Yes.
Sorry, Ed Hill, County Administrative Officer. I just want to take this opportunity to also thank Jimmer for all of his guidance and support for coming here from San Luis Obispo as a past department head and a new CAO. His guidance and leadership has been pivotal, especially during this tumultuous time during COVID and all the different funding streams that we have coming our way. So even though Catherine's forgot your name already, we haven't. So thank you, Jim. I appreciate it.
All right. Thank you. And I believe that'll be all the stuff we have on unscheduled. So at this point, we'll move to item 3, which is approval of the minutes. And item 3A is a report out of closed session from August 31st, 2021.
And thank you, Mr. Chairman. Your board took no reportable actions.
Okay, very good. Then we'll move to item 3B, which is approval of the minutes from the August 31st, 2021 regular meeting.
I'll make a motion as presented. Verboen.
Second.
Okay, we have a motion and a second. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Did I hear?
Yes, that was 5
Yeah,
in favor.
Did we have, I didn't hear Supervisor Fagundes' vote.
He voted yes.
Okay, we have 5 in favor. Thank you. And motion carries. We'll move to item 4, which is the consent calendar. Board, what's your pleasure?
Nevs moves the consent calendar as printed.
And Verboen seconds.
All right, we have a motion and a second. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Is he doing that on purpose? I believe we have 5 in favor, so motion carries. We'll move to item 5, which is regular agenda items. And item 5A is from County Council.
This is Diane Freeman on behalf of County Council's office. Good morning, Mr. Chairman, members of the board. I come before you today by request to present options for expanding the county's scope of redistricting public outreach to remote locations throughout the county. The county's current outreach plan provides for 4 public hearings to take place during the board's regular meeting and 1 public hearing to take place in the evening. The current plan satisfies all requirements of the law and goes above and beyond. Consequently, the first option I present for your consideration is to make no change to the county's scope of public outreach. Other options include holding public hearings or public workshops in remote locations. These are identified as options 2 and 3 in your agenda. Given the stage we are in at the redistricting process, both of these options present daunting challenges with respect to time, the availability of consultants, and cost. With the anticipated release of the state's adjusted census data on September 20th, 2021, we are on the verge of shifting focus from educational outreach to the map drawing process, and any additional hearings at this late date could create confusion. In addition, the only date the county's consultants have available to assist with additional workshops or hearings is September 25th. With all the variables, the viability of options 2 or 3 is questionable. Finally, I present for your consideration option 4. Option 4 proposes to have county staff present educational materials at city council meetings throughout the county. Under this option, county staff would provide informational presentations about the redistricting process to the public at agendized city council meetings. These would be informal presentations only, with staff directing individuals who desire to make comments to do so through the county's website and other established channels. The county could rely on existing recording processes at each city location and obtain recorded copies of the presentations for its record-keeping purposes. Upon request, the county would be required to incorporate Spanish language interpreting services, and that would incur an additional cost. With that, I submit these 4 options for your consideration. and I'm available to answer any questions.
Very good, thank you. Supervisor Valley, I'm sure you have questions.
Oh, yeah, thank you, Mr. Chairman. Hey, Mr. Chairman, look, one, I reached out to the mayor of Avenel, Alvaro Preciado, and the mayor of Corcoran, Pat Nolan. Spoke to them. They asked me to relay that, yes, they did. It was their hopes that the county would expand on these hearings around the county. We knew going in the timeline, so it's a little disappointing to use time today as a reason not to do it. That being said, Mr. Chair, they asked me to communicate what the hopes would be a compromise here with the Board of Supervisors and county staff to go with option 4. They would make available on their agendas and have their staff work with our staff to get a presentation on their council agendas. And then they would do their best locally within their communities to let folks know about that and the opportunity to come down. And so they would appreciate that, Mr. Chairman. And I believe that's option 4. And so I put that before you in the board today, relaying that communication. Thank you, Mr. Chairman.
Okay, thank you. Other comments, questions from the board? Right. Was that in the form of a motion, Supervisor Rowley?
Mr. Chair, if there's no comments or questions, I would respectfully make a motion to take up item 4 and have this information taken to the city council meetings around the County of Kings to further educate the community on the procedure we're now doing on redistricting. Thank you, Mr. Chairman.
Supervisor Valley, one question with respect to Avenel and Corcoran. I know one of our challenges is the technical side of having a meeting at remote locations, and I don't know if staff has had time to review the ability of us to do that, complete that process in the required way.
Yeah, Mr. Chairman, again, if we go through these city councils, they already have their built-in equipment. Obviously, they've been broadcasting virtually as well throughout the pandemic. And it seems the easiest way to do this, to get some information out, which that is the goal anyways, from what I understand. And as far as the cost of it, that would keep the cost down compared to the other costs for these other options.
Okay, thank you. Right, we do have a motion on the floor. Is there a second? Second, Verboen, is that here?
Yes.
Okay, we have a motion and a second. Madam Clerk, would you please call the roll?
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboen.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
And I'm not hearing his, I don't know if his mic's not working or what, but was that a yes?
My mouth is.
Was it a yes?
That was a yes.
Okay, thank you. All right, we have 5 in favor, motion carries. We'll now move to item 5B, which is from the fire department, and Chief Lynch.
Good morning, Mr. Chairman, members of the board. Bill Lynch, Kings County Fire Department. Here today with an agreement for fire services with the city of Avenel for approval. As you know, Kings County Fire and the city of Avenel and Corcoran both have had contracts for fire service for many, many years, and I'm very proud of the fact that we've reached agreement this year. This contract has been approved by County Council, and if you'll look at the second page on the agenda item, you'll note that it is a $35,000 increase in what the city is going to pay this year. This is a 1-year contract retroactive back to July 1st of 2021. I'd be happy to answer any questions.
Very good, thank you. Questions from the board?
Motion approved, and thank you.
Okay.
Right, we have a motion and second. Madam Clerk, would you please call the roll?
Joe Nevs.
Yes.
Richard Valley.
Aye.
Doug Verboen.
Yes.
Craig Peterson.
Aye.
Richard Fagundes.
Yes. Okay, we have 5 in favor, motion carries.
Thank you.
Thank you, Chief Lynch. We'll move forward to item 5C, which is from Human Resources. And Kenny Ray.
Good morning, Chairman, members of the board. Henny Ring with Human Resources. Today's item I'm proud to announce and bring to you as the Memorandum of Understanding between the county and the California League of City Employees Association, also known as CLCIA, which represents the General and Supervisors Unit. The county's agreement with the General and Supervisors units for the 2017-2020 Memorandum of Understanding allowed for either party to reopen the agreement to discuss economic changes prior to the June 30th, 2022 expiration. Negotiations were conducted in good faith with CLCIA, and successor agreements have been reached between the parties for the term ending in June 30th, 2025. These agreements have been ratified by the memberships of each unit, and staff recommends the approval by the Board of Supervisors. Some details with the MOUs would be that the General and Supervisor Unit agreements will provide for salary increases of 4 ranges, approximately 4%, effective September 6th, 2021, which is pay period 19, for classifications not identified for a minimum wage increase on July 1st, 2022. Classifications identified to receive a minimum wage increase on January 1st, 2022 will receive the salary range increase range of 7 ranges, approximately 7%, effective September 6th, 2021, which is pay period 19, instead of the January 1st, 2022 date. Additionally, all employees in the classification covered by this agreement shall receive a lump sum of $500 effective September 6th, 2021, which would also be pay period 19, its current pay period. In the second year of the agreement, salary increases of 3 ranges, approximately 3%, effective fiscal year 2022-2023, July 1st, 2022, pay period 15 for classifications who do not receive the minimum wage increase for January 1st, 2021. In the third year of the agreement, fiscal year 23-24, all employees in the classifications covered by this agreement shall receive a salary range increase of 1 range, approximately 1%, effective January 10th, 2023, which is pay period 15, 2023. In the fourth year of the agreement, which is fiscal year 2024-2025, all employees in the classification covered by this agreement shall receive a salary range of approximately 1%, effective July 6, 2024, which is pay period 15 of 2024. I know that was a lot. So essentially, in the first year of the agreement would be 4% for those who are not a minimum wage increase. The second year, they receive 3%, again, non-minimum wage classifications. The minimum wage classifications, which equals the 4 and the 3 equals 7%. The minimum wage classifications would receive that now at 7%. They would not receive a 3% in the second year. The third year and fourth year, it's both all classifications would receive the 1%, the third year and the fourth year, just to break that down. In addition to the salary increases just described, this agreement proposes that during the term of agreement, any increases in the health insurance premium will be split 50-50 between the employer and employee. This agreement also proposes continuation of holiday closure for the years 2021, 2022, 2023, and 2024. Also, Article 26, which is the uniform allowance, provides an increase for the Juvenile Corrections Officer Series to increase from $400 to $450. The memorandum of understandings have been updated to incorporate all modifications as previously agreed to, as well as minor wording and updates, in addition to elements described about are just described. The MOU for the General and Supervisor Unit were attached with your agenda packets, which showed all additions highlighted in red and underlined, and any deletions were marked with a strike through. I do want to call out that within the Supervisors Unit Appendix A, we had omitted 4 classifications that had been updated, but we hadn't updated it since the last MOU. They have now since been updated, so they will be reflected as classifications represented by the Supervisors Unit in that Appendix A. The other thing I wanted to call out is extra help is not under the general or supervisors unit, they're not represented, so they are not part of the increases. And that's one of the things I wanted to highlight. The recommendation that I'm asking for the board today is for the Human Resources Director and designated staff to sign the successor agreement for the general and supervisors unit with a term ending June 30th, 2025. And I'm available for any questions if you have any.
Very good. Thank you, Annie. Questions, comments from the board?
I'll second Fagundes' motion.
Very good. All right, Madam Clerk, we have a motion and a second. Would you please call the roll?
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Okay, we have 5 in favor. Motion carries. Thank you.
Thank you.
Thank you, Annie.
Thank you.
Okay, we'll move to item 5D now, which comes from Public Works and our Public Works Director, Dominic Tyberski.
Good morning, Mr. Chairman, members of the board, Dominic Tyberski, Public Works. I am before you this morning to request adoption of the resolution of intent to form a zone of benefit for track 756, phase 4-3 of the Armona North subdivision in the unincorporated community of Armona. Additionally, I am requesting a public hearing be set for October 5th of this year to hear testimony regarding the formation of the zone of benefit. And the third requested action is to introduce and waive the first reading of the ordinance to impose a parcel tax for road improvement and maintenance within zone of benefit 4-3. Phase 4-2 of this tract, 756, was the first phase in which the county implemented a zone of benefit. Prior phases relied on the formation of a homeowners association, which would then be responsible for the roadway maintenance. Inherent challenges proved this model to be ineffective, and so the county moved forward with the zone of benefit model to collect a parcel tax. This will be used by the county to provide roadway maintenance on the corresponding roadways within the subdivision. So at this time, I'd be happy to answer any questions you might have.
Very good, thank you. Questions, comments from the board?
I'll make a motion to approve as presented.
All right, thank you.
Nevs will second.
Good. All right, Madam Clerk, we have a motion and a second. Would you please call the roll?
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
We have 5 in favor. Motion carries. Thank you, Dominic.
Thank you.
Right, we'll now move to item 5E, which comes from administration.
Thank you, Mr. Chairman. Ed Hill, County Administrative Officer. Just wanted to remind the board that we've received several suggestions to pull and table this item to a later date. I'm willing to present the item or take your board's pleasure.
Very good.
I'll make a motion to table it.
Okay.
Nevs second.
Okay, so we have a motion and a second to table item 5E 1A. We have a motion and a second. Madam Clerk, please call the roll.
Joe Nevs,
Yes.
Richard Valley,
Aye.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 5 in favor. Motion carries.
Mr. Chairman, for clarification, you indicated that was 5E1A, but is their
A and B.
current items?
Okay, very good.
And Mr. Chair, for clarification as well, was that tabled until next week?
Yes.
I think it's tabled until such time as we can, gain further knowledge and hear arguments.
Okay.
All right. We'll move now to item 5F, and that comes from the Public Health Department. And please go ahead.
Hello, good morning, Chairman and members of the board. Heather Silva with Public Health. I would like to start my report off by reminding everybody of the simple steps that we can all take to protect ourselves from communicable diseases such as COVID-19. Frequently wash your hands for 20 seconds or more. Do not touch your face with unwashed hands. Stay hydrated with water. A hydrated cell is a healthy cell.
Stay home if you are sick. Wear a face mask to continue to protect those unvaccinated around you and to get vaccinated yourself. Also, as a reminder, our daily numbers are available on our website. We continue to watch hospital data closely. Regionally, hospital admissions in med-surg and ICU are continuing to increase, including here in our local hospital. As of September 13th, the local hospital had 72 patients in med-surg and 9 patients in the ICU. And of those admitted, 46 are Kings County residents. Since July 1st, unvaccinated COVID patients have accounted for 89% of the admissions, and 11% of those hospitalized have been vaccinated. Adventist Health has requested 22 registered nurses through mutual aid requests and has received 3 ICU nurses so far. And we are monitoring hospital resource requests daily and will assist as necessary. As a reminder, the assess and refer policy that was currently in place via the Central California Emergency Medical Services Agency, also referred to as IMSA, directs paramedics and EMTs to refer a patient to urgent care or their provider if after a full assessment, the patient exhibits no emergent conditions that would require immediate transport to the emergency room. On September 4th, IMSA sent an additional memo directing ambulance providers in Kings and Tulare counties to implement, as part of their assess and refer policy, the requirement that any patients meeting the criteria for referral will no longer be transported to the hospital. The EMS policy allowed ambulance transport if the patient insisted. However, due to current conditions at hospitals in Kings and Tulare County, this exception is removed and patients meeting criteria will no longer be given the option for transport. Our PPE status has not changed, and we are still maintaining a 60-day supply of PPE for our healthcare facilities. The mobile testing site scheduled for this week is on our website, and testing demand continues to increase. To put this into perspective, from the last week of July compared to this past week in September, there was a 504% increase in tests handled by the health department. We continue to surpass our internal record for the number of tests processed in one day, and that record stands at 908 tests processed in a single day by our department alone. This is driven in part by testing requirements for schools, healthcare, and other congregate facilities, not exclusively symptomatic patients. We remain committed in continuing testing or keeping testing readily available throughout the county, particularly in areas where healthcare access is a barrier, Avenel, Corcoran, Armona, and Home Garden. So I want to remind you that some California counties are still reporting a shortage of testing kits and wait times as long as 1 week for testing appointments, plus additional time before results are received. As of right now, Kings County is not one of those counties experiencing this issue, but we are keeping a close watch on testing kits and supplies as our testing numbers increase weekly. We continue to experience a turnaround time at about 72 hours for tests that are both being processed in the state lab and private labs in Kings County. We had 642 new cases last week, September 6th through September 12th, and 787 new cases in the previous week, August 30th through September 5th, bringing our new case count since the start of the surge to 4,530 new cases. In the past 2 weeks, we have seen a significant rise in cases among the 0 to 11 age group, with a slight increase among the 12 to 15-year-olds, while other age groups remain consistent. Our Delta variant case count has also increased to 139 since our August 31st report, as the variant continues to spread. Currently, there are 48,224 reported cases of the Delta variant in California. Last week, September 6th through the 12th, Public Health administered 352 vaccines, and the previous week, August 30th through September 5th, we administered 502 vaccines, which is a slight increase from the 2 weeks prior. We hope to see vaccination numbers continue to increase as people are recognizing the benefits of vaccination and are making the decision to protect themselves and others. The health department continues to administer the additional 3rd dose vaccine for immunocompromised individuals, and we continue to have appointments and walk-ins available. The approval for vaccine boosters for those 65 and older and other populations has still not been received, but is expected in the near future. And I did want to take some time to kind of explain the difference between the booster and the additional dose. We've had some questions with that within the public. So a booster is given 8 months after the 2nd dose. And this is given to individuals with a standard immune system who build protection from the 2-dose series that the immunocompromised individual may not necessarily be able to build with that same series. So this booster is intended to help someone maintain protection from the virus as their protection starts to decrease over time. The additional dose, which we are currently administering within our department, is a 3rd dose of the mRNA vaccine, which is Pfizer and Moderna, and is given 28 days after the second dose of the series. This is to help the immunocompromised population build protection from the virus that they may not have been able to with the first 2 initial doses. I am sure you have heard in the news that President Biden released his COVID-19 plan, and the way that we understand it now is that the vaccination portion of the plan will require all businesses, private and public, with 100 or more employees to require proof of vaccination, or they will be required to test at least once weekly. OSHA is expected to issue an emergency temporary standards on the requirement, which is estimated to impact more than 80 million workers across the country. We continue to add pop-up sites and mobile vaccination locations as staffing allows, and are also working with interested parties on requesting mobile vaccination clinics from the state when the department cannot fulfill this request. So far, Kings County providers have administered 106,525 vaccines to county residents. The number of partially vaccinated Kings County residents is 10,284. The number of fully vaccinated Kings County residents is 48,927 vaccines. Our current breakthrough rate is at 1% of our vaccinated population, which is an increase from 2 weeks ago, but is still very low, indicating that the vaccine is working as intended. We also wanted to provide an update on hospital surge and address Supervisor Peterson's questions from last meeting regarding the alternate care sites, also referred to as ACS. It is our understanding that at this time, the state does not plan to open up the Porterville ACS site or the Fresno ACS site or any other sites at this time. Because these sites went largely unused last time they were deployed, the focus is instead on delivering staffing resources and what's known as level loading for ICU patients, in which they are transferred to other hospitals with bed and staffing availability. As mentioned previously, level loading is initially coordinated at the local level through medical health operations area coordination, which is also referred to as the Mohawk program. The state is also working on identifying some larger hospitals in the region to act as level loading facilities. Cuya Delta Community Regional Medical Center and Kerr Medical are under consideration for this purpose, and the state would supply the additional staffing needed for these facilities. We will continue to provide updates to your board as we learn of them. Supervisor Valley also asked about the department's work partnering with CBOs in the area for COVID-related outreach. The department currently works directly with 3 local CBOs on various aspects of COVID outreach, as well as churches, schools, and city governments to get the word out about the services that are available. We have extended the opportunity for partnership to additional CBOs and have plans to continue expanding to additional communication channels in the coming weeks as well. The takeaway from this week's report is that we continue to see an increase with the current surge and see significant strain on our hospital system statewide. Changes are being made at the state and local levels in order to help alleviate this strain. Our department will continue doing all that we can to assist the healthcare providers and members of our community to meet the demand for COVID-19 related services. Our approach will continue to be layered, including but not limited to vaccination, testing, and encouraging those everyday measures that can make a significant difference, such as hand hygiene, masking, and isolating when you're sick. This concludes my report, and I'm happy to answer any questions.
Very good. Thank you, Heather. Questions from the board?
Yes, Mr. Chairman.
Supervisor Valley.
Yes, Mr. Chairman. Thank you. Thank you for the report, and thank you to the staff. The 900 tests, you guys have to be exhausted, so that that work and that effort does not go unnoticed. So thank you again. Mr. Chairman, I guess my question is it relates to Adventist, and we're talking hospital surge. Is there anything, and I know this is a question for staff, is there anything that the county can do that we haven't done already to work with Adventist to help them either financially, and if so, does financial assistance open up more beds? I guess that's the simplest way I could put that.
As this time, the way I am understanding it with Adventist Health is the financial part is not the issue. It's just the amount of healthcare staff available. We did hear that Fresno County got over 100 nurses, and then Adventist Health got 3. But as of right now, we're doing the most that we can as a county. Our emergency planners do work with them very closely to kind of help coordinate these requests and any additional requests that they do need. We can definitely speak with them and see if there's anything else that we could offer assist with to help the burden of the short staffing.
Thank you. On that, and I brought this up the last time you were given the report, but on that, I remember Mr. Hill just over a year ago when we were talking CARES funds. The first time we had the presentation on that proposed budget, there was that, I forget what he called it, but it's basically just a rollout shelter that included a number of beds. And so I wanted to see if we can get an update on that to see if that is something that should be talked about again. And is that something that could, if the county purchased that, could be set up logistically with Adventist to help clear up some more space or be more attractive to get more health staff sent there due to them having extra space. And I hope that makes sense.
Yes, definitely, Supervisor Valley, the chair. So we can go ahead and get another quote like we did a year ago when this was initially brought up. It does not include the cost of the generators, and this facility would not necessarily come with staffing from the state, which is again our main barrier to care at this point. So we could definitely look into getting a quote, speaking to the vendor, and seeing what our options are if that's needed.
Okay, thank you, Mr. Chair. I'll just close with this. The man, as you're looking around, even last night, it was heartbreaking to see the story break on the Fresno Bee that Fresno State University is looking at an option of shutting down all in-person courses right after the Thanksgiving holiday, and the issues that it causes for those students financially, mentally, just everything those young folks have already been through as well. If we just focus on that part of the pandemic and the population, the point of that is there is a lot obviously going on. There's big decisions that are being made, and I'm hopeful that after today's whatever happens today at the election, the ballots office, that we can move forward and again focus on this pandemic, because it's not going anywhere, and by all signals it looks like it's going to get worse. And I think it's appropriate to be prepared to meet that as we know what's coming and what may still be yet to come. Thank you, Mr. Chairman.
Thank you. Other comments from the board?
Nope. Get vaccinated.
Thank you.
Yeah, no, I agree. I think, I guess hospitals, at least the conversations I've been hearing, are not immune from, vaccination, I guess resistance from getting the vaccine as well. And I know some staff members, have had an issue, and you've heard that some have left because of the mandate to get a vaccination. And so I think, as an employer, the hospital is not immune from those challenges as well. And anyways, this continues to be a challenge. Thank you for your comments, Supervisor Valley, and we'll continue to put our best foot forward to assist in any way we can to, deal with this issue.
Mr. Chair, I have a
Yes, sir.
question for Heather. So Heather, I had dinner on Saturday night with a emergency room nurse from the hospital here in town, and she works here in Fresno. And she volunteered to give her stories to our board to share to the public about how bad it really is. People are coming in there, that have not been vaccinated, begging to get vaccinated at this time, and it's too late. And she'll have to incubate them, and then within several days they pass away. People are so upset about the political pressure of being forced to get a vaccine, they don't want to do it. But once they get sick, they wish they would have done it. And is that something you think would help our community if we had someone tell a story about what's actually happening in the hospitals?
Yeah, Supervisor Raboon, through the chair, I definitely think testimonials with people who are experiencing that day in and day out would definitely help. We encourage it as a public health department to everybody. And I think hearing it from people, it's hard for us who don't see what's going on in the hospital and are through those walls every day. But I definitely would encourage people to come forward and kind of give their insight on that to see if that could help encourage people to get vaccinated.
Yeah, we had Channel 17 did a story on a gal that grew up here in Hanford, and she was resistant to get the vaccine, and she passed away on October 14th. And her family was, telling her, get the vaccination. She said, "No, I'm healthy. Why would I get it?" Now that the Delta variant is here, people that are healthy are dying, and we need to get that word out and not make it political, and not, I don't want to be someone, I don't want to tell anybody to get a vaccine, because I have no knowledge of being a medical care physician. But I think, I talked to Adventist Health, I believe the public relations representative. I said, it'd be nice if you guys would come up and step up a little bit and start sharing some of your stories and not put it on our shoulders. Because people, go against us, and then some people want us to do something. So I'll reach out to the nurse or the hospital, or maybe if you talk to them, if they can come make a presentation, someone with some power or some knowledge that can share some stories that get people's attention. I know for myself, I got back there early on, and I was probably going to be resistant at first, but I thought twice about it. So I think it's important. We got to get that message out.
Yeah, we'll definitely reach out to Adventist Health and see if there's somebody there, that nurse that you said that you saw on
We
Saturday.
give a report today in Tulare County Board of Supervisors
Okay.
on homelessness and how it affects them. So I'll see if I can't get her name and a number.
Okay, great. Thank you.
Yeah, thank you, Supervisor Verboen. I think we all know folks that are being challenged by this. Last week, we were informed a good friend tested positive, and we found out yesterday that she was admitted to the hospital yesterday with heart issues and also low blood oxygen. So it occurs quickly, and they were non-vaccinated. So we do your best to be thoughtful about this. All right. Any further comments on this issue?
Mr. Chair.
Yes, sir.
Ed Hill, County Administrative Officer. I just want to hold with the tradition as Mr. Spike started and give an update on the Kings County workforce. Since the surge has started in July, we now have 98 cases. That's a total for that surge. That is not the number of recovered or those teleworking or quarantine at this time. I don't have that number. I'll make sure I have that for you next week. Also, I wanted to provide an update that we participated with the Public Health Department in a White House briefing on the executive orders that they issued last week. As Ms. Silva indicated, there isn't a lot of information, and that information is forthcoming. And when it's released, I'll go ahead and share that with your board.
Very good. Thank you. Great. One last time, any further information? Okay. So then at this time, we'll move to item 6, which is an administrative hearing, and I'll check with staff. We'll probably need some time to transition.
County Council is ready to go as soon as you call the matter.
Okay. All right. Very good. Then we'll move to item 6, which is an administrative hearing. And my notes on this is to conduct a hearing with respect to a protest of RFP 2021-72 from Kingsview. And just for informational purposes, today we will be conducting a hearing to make one of the following findings. 1, that Kingsview's protest lacks merit and behavioral health's recommendation to award RFP 2021-72 to Mental Health Systems, Inc. was reached in a fair, reasonable manner, and therefore will not be overturned by the board. Or 2, Kingsview protest has merit, and this board finds that all proposals received in response to the RFP 2021-72 must be reevaluated by individuals other than those involved in the initial evaluation committee. Or 3, Kingsview's protest has merit, and this board finds RFP 2021-72 a failure, rejects all proposals received in response thereto, and directs behavioral health to issue a new RFP for specialty mental health services to children and youth. So with that, as we move forward, the process for the hearing will go as such. This will start with testimony from behavioral health.
Yeah, Mr. Chairman, if I may have just to provide a brief overview from County Council before you actually open the public hearing portion of this item.
Yes, ma'am. I'm just giving the outline of how it may go, or is that something you will do?
You are free to give the outline of how it will go.
And
So you can continue. I
got
think
you.
it was a misunderstanding that we were going to start the public hearing right now, but
Yes.
continue and then I will make a statement afterwards.
Okay, yep. So to amend my statement, the county council will give an overview of this, and then we will call on those involved in the RFP, which is behavioral health. And behavioral health will provide testimony. The board will have time to ask questions. The appellant will have time to ask questions of behavioral health. Then we will move to Kingsview, and the same process will follow. And the board will make determinations on how we proceed with that information. So with that, I will return back to County Council.
Thank you. Your board is here today to consider Kingsview's appeal of RFP 2021-72 for specialty mental health services to children and youth. The purchasing department issued the RFP on behalf of behavioral health on May 12th, 2021. The deadline for submitting proposals was June 18th, 2021. The purchasing department received responses from 3 prospective bidders. Upon behavioral health's evaluation of the proposals, specialty mental health services received the highest score, and behavioral health recommended to the purchasing department and the Board of Supervisors that they be awarded the contract. Purchasing sent notice of the intent to award on July 26, 2021. Believing itself to be aggrieved, Kingsview timely protested the award recommendation. On August 9th, 2021, the purchasing department sent Kingsview a letter denying its protest. The same day, Kingsview notified the county that it would appeal its protest to the Board of Supervisors as permitted under Section 9B protest procedures of the county's purchasing policy. Kingsview submitted this current protest of award to the clerk of the board via email on August 13th, 2021. Kingsview's stated basis for appeal is that it believes behavioral health is retaliating against Kingsview for soliciting help from the Kings County Board of Supervisors in relation to a prior contract. The issue on appeal is whether the recommendation to award the RFP to Specialty Mental Health Systems, Inc. was reached in a fair and reasonable manner. If the answer is yes, behavioral health's recommendation cannot be overturned. If the answer is no, the board can either 1, order all proposals received in response to RFP 2021-72 reevaluated by individuals other than those involved in the initial evaluation process, or 2, reject all proposals received and direct behavioral health to issue a new RFP for specialty mental health services to children and youth. As the chairman indicated, the hearing will proceed as follows. Behavioral health will present its case. The board will have the opportunity to ask questions. Kingsview will then present its case, and the board will again have the opportunity to ask clarifying questions. The board will then have the opportunity, behavioral health will then have the opportunity to rebut testimony offered by Kingsview. And the board, at the conclusion of that, will again have the opportunity to ask questions. Testimony should be focused on the RFP process and the fairness of that process. At the conclusion of the hearing, the board may issue an immediate decision or take the matter under advisement and return with the decision after further deliberations. And with that, I turn it back over to you, Chairman Pedersen, to open the public hearing.
Okay, very good. Thank you for that. Diane, I have one question. With the questioning of testimony provided, only behavioral health will have the opportunity to question that. The appellate does not.
You mean the rebuttal testimony?
Yes.
You, at your discretion, can allow a back and forth as you deem necessary. The parameters for that are under your discretion, and I will leave it to your discretion to allow that to go back and forth.
All right, very good. Thank you. Okay, so at this time, we'll go ahead and open the hearing and start the testimonial process with behavioral health.
Mr. Chairman, if I may, this is Ed Hill, County Administrative Officer. Just wanted your board and the audience to know that Richard Valley has signed off the meeting. So it is the 4 board members in chamber, excuse me, 3 board members in chambers and 1 virtually.
Very good. Thank you.
You hear me okay?
Yes.
Good morning, Mr. Chairman and members of the board. I'm Lisa Lewis, Dr. Lewis. I'm the Director of Kings County Behavioral Health. And with me today, we have our 2 deputy directors, Katie Ernst and Unchung Perry. Thank you for this opportunity to present to you this morning regarding the department's recent request for proposals for specialty mental health services for children and youth. The Behavioral Health Department, serving as the mental health plan, is directly responsible to the state of California for the provisions of community mental health services in Kings County. This responsibility includes the performance contract with the state, which sets out the conditions and requirements that all counties must meet. In an effort to meet these requirements, the department undertook an expansion of mental health services between the years of 2018 and 2021. Most notably, we added higher levels of care for adults, including the ACT team. We added a higher level of care for children, including the full service partnership clinic, and we added telepsychiatry for both children and adults. This process requires putting out RFPs and contracting with new service providers for 4 new providers. These new clinics greatly expanded the breadth of available mental health services to beneficiaries of our county, and children successfully transitioned to the higher level of care. As the department continues to work to meet our requirements of DHCS, all of our contracts will need to be brought up for RFP at reasonable intervals of time, and it is our intention to follow this standard business practice. This year, we chose to go out to RFP for specialty mental health services. We had 2 overarching goals when we did this. We wanted to expand the number of children that were seen for specialty mental health services, and also we wanted to make services available in a manner which is most accessible to those children and their families. In order to do this, we really had 4 areas of focus. When it comes to the number of children served, we are informed about our performance every October when we have an external quality review. This is something that's done on behalf of the state through a third-party reviewer every October. They're coming next October. And one of the things they do is they give us statistics about our performance, and they compare us to like-sized counties. So when it comes to the number of children we're seeing in this county, in order to approach a number that is equal to other like-sized counties, we would need to be seeing 350 more children per year. So even though we have transitioned some children into a higher level of care and we've provided a higher level of psychiatric care, this hasn't necessarily increased the number of children that we've been seeing. This has basically been a transition of some children. So it is our goal to increase that number. Additionally, the department would like to have a specific service that's provided to children called intensive case coordination, provided by the same provider who does our specialty mental health services. So we're hoping to get that in the future. Also, the department intends to increase the number of children that are being seen at school, on school property. And 4th, we strive to be responsive to community feedback that we have received. When we went through our MHSA community planning process in 1920, one of the key outcomes of that was a request for increased services for children and youth. And this came at a time when we had already increased services for children and youth. So in our mind, what we have done is we have provided levels of care, but we are likely still seeing the same number of population. And we would like to work towards increasing that and becoming much more like-minded counties. Like-minded, sorry, like size. So regarding this RFP, which is in dispute today, the RFP was facilitated by our Deputy Director of Clinical Services, Katie Ernst. Katie's going to walk you through the process and the timeline, and she'll also review the scoring system, the scores provided to us by the scoring panel, and the highlights of the successful bidder's proposal. One question that's come up is the release of the RFP. RFPs, the proposals by other bidders. Section 4.2 of the RFP states, quote, "Proposals are only confidential during the evaluation process. Once an agreement has been signed between the county and the successful proposer, any and all proposals shall be submitted to disclosure under the California Public Records Act." So the department has not yet released the other bidders' proposals because there is no signed agreement between the county and the successful proposer at this time. The department is not aware of any the department is not aware of any inappropriate, any diversion from the appropriate RFP guidelines as set forth by the county. We believe that this RFP has been fair and well executed, and we will follow any guidelines given to us by the board. Thank you for your time and attention to this matter, and I'm going to turn this over to Katie to walk you through the how and the what of what we did. Katie?
Good morning, Chairman Peterson, Board of Supervisors. I'm Katie Arntz, Deputy Director of Clinical Services for Kings County Behavioral Health. The department began drafting this RFP in early 2021, and as council shared, it was issued by the Purchasing Division on May 12th. Purchasing and the department hosted a pre-proposal conference shortly after the RFP was issued. Additionally, during the proposal window, there was a request to extend the deadline. So the deadline was extended from June 14th to June 18th. As council shared, 3 proposals were received, one of them being from Kingsview, one from Mental Health Systems, and then an alternate organization as well. In order to evaluate the proposals, the department convened a 5-person scoring panel. That scoring panel included 1 member of the Kings County Office of Education, 1 member from the Child Welfare Services Department, and then 3 Kings County Behavioral Health Program managers. Next up, I'm going to talk about the evaluation criteria, which was published in the RFP in section 3.4. Each proposal was evaluated based upon a 100-point scale, and it had 5 specific criteria areas. The first being qualifications and past experience. That was worth 15 points and included each proposer's qualifications and experience in the provision of trauma-informed and evidence-based services for children and youth under the age of 21. The second criteria was work plan and program approach, which was worth 35 points. This included the specific approaches and practices to providing specialty mental health services and early and periodic screening, diagnostic, and treatment services to children and youth. The third criteria was financial and organizational stability, which was worth 15 points. And this was the proposer's ability to provide sustainable services and promote a responsible use of public funds. The fourth criteria was cost and budget, and this was where the proposers included their budget and a budget narrative, in addition to their estimated Medi-Cal revenue and any additional funds or in-kind services that might be leveraged. The last area was quality assurance and oversight, which was worth 20 points. This included the proposer's description of organizational experience and their proposed plan to build organizational capacity to meet Medi-Cal billing, clinical, and quality assurance requirements. I actually was the one who facilitated a meeting with the scoring panel, where the panelists each presented their findings and their scores for each of those 5 components within the RFP, and their scores were as follows. Mental Health Systems scored 83.8. The other proposer was 77.4, and Kingsview scored 74.8. At the conclusion of the scoring panel meeting, the scoring panel recommended to the department's executive team that a oral presentation be scheduled with each proposal for clarifying questions that they had for each of the proposers. So oral presentations were scheduled in accordance with the RFP in section 3.6. Each proposer was given a set of questions in advance of the presentation, and the oral presentation panel was made up of department staff, but was also not scored. After the conclusion of the oral presentations, a summary of both the scoring panel recommendations and the results of the oral presentations were presented to the department's executive team. The team reviewed the findings and determined that the oral presentations supported and validated the results of the original scoring panel's recommendation of mental health systems being the successful bidder. Lastly, I'm going to share a bit about the department's recommendation of mental health systems being the successful proposer and successful bidder. First, mental health systems proposal was the highest scoring proposal from the scoring panel. Their proposal scored top in 3 of the 5 evaluation criteria. And in addition, I wanted to touch on a couple of key areas from their proposal. One was their staffing pattern, which was proposed clinicians and rehabilitation specialists, which most closely align with the Department of Healthcare Services network adequacy standards for mental health plans for the clinician to beneficiary ratio. Second, in the area of school-based services, mental health systems is experienced in providing services to children and youth in school-based services in both Fresno and San Diego counties. They proposed a detailed plan for implementing services at school sites throughout the county, including staff that would specifically focus solely on school relationships and school-based services. Third, location and timing of services. The mental health systems proposal emphasizes that services will be provided at times and locations that will be most convenient for children and youth and their caregivers, including an emphasis on providing home-based services and community-based services. Lastly, in regards to outcomes, mental health systems proposes a solid outcome evaluation plan, including 11 specific measures that emphasize children and youth remaining in their homes, improving school attendance, decreasing probation violations, and improvement in social and emotional well-being. This is the conclusion of my overview of the RFP process and the department's recommendation. Thank you, Chairman Peterson, Board of Supervisors. The department is available for any questions.
Supervisor Peterson, I think you're on mute.
Thank you for that. Yep. Katie, I have a question. With respect to how you establish a review panel, is there any mandated form in which that has to occur, or how do you justify or make that choice?
Our department has a practice of identifying an odd number of attendees for our review panels, and we typically intend to have, so if there's a review panel of 5, at least 2 reviewers who are not a part of the current department. And so that's been our standard operating procedure for review panels.
Supervisor Peterson, there's no specific requirement for any of this, but what we do is we reach out to our partners in the county and the community. So Office of Education, child support, things like that. So CWS, so that those folks who are going to be interacting with these same children will be represented on the panel.
Okay, thank you for that answer. Again, I'll go back to the board. Any further questions from behavioral health?
Just one for council, I believe. So on the RFP process, we have a great number of people here today that saying that we did it wrong, and they would like to appeal it. How do we know? I mean, I'm not familiar with the RFP process when it comes to the behavioral health and then where we would have made a mistake or not made a mistake. Can you enlighten us on that a little bit of where we followed, all rules were followed, or?
I can certainly give you my my thoughts on that. I can tell you that the RFP process is outlined in our purchasing policy, that based upon my review, I mean, absent testimony from Kingsview, that's what the purpose of this is today. They're here to establish that there was a violation of the policy or that they did not obtain a fair process rather than having me identify. To me, it appears as if the processes were followed, but I'm interested in the testimony of Kingsview to see if they can identify anything. And we can talk about the particulars of those policies in deliberations.
The process in place was followed as far as you could tell.
As far as I can tell.
Thank you.
Okay. Any further questions?
Nope, I'm good.
All right, then at this time we'll move to testimony from the appellant, Kingsview. Please proceed.
Thank you, board, so much for this opportunity. I've had a lot of sugar and a lot of caffeine. So if I talk too fast, please slow me down. And if I drop, let me.
Restart to state your name.
Okay, see, and there you go. I am Dr. Amanda Nugent Devine, and I am the CEO of Kingsview. And I'm sorry, I just have to thank all of you for this time. I want to thank Kingsview who has logged in. Bless you. And I want to thank all of Kingsview in this audience because these people care so much and I'm so grateful. So I might get emotional and I'll try not to. Okay, I want to first start by explaining that we have, and I'll put this down if I may, I see that's covered. We have never, in the tenure of Kingsview that I'm aware of, and certainly under my tenure, we have never appealed an RFP decision. We have actually applied for a ton of them. We lose some, we win some. That's how it works. But what we always do is we get a rubric that shows us next to the person that we applied against and the other contenders. And literally question for question, we get to see what our answer got rated and why, and what their answer got rated and why. So we actually, Kingsview, use that as a growth opportunity, a way to say, wow, we can do better in this area, or good, we're on the right track there. This is what they're looking for. It is a learning process and something we welcome. However, this is a very different situation. I would be remiss if we were not here today and did not defend and protect the amazing work our staff have done for 2 years through COVID. People who have gone to serve children at the risk of themselves and their families with not adequate PPE because we're not considered a healthcare service. That is a fault of the nation that they are fixing, and we are grateful. But nobody was ready for a global pandemic. And when it happened, healthcare service, understandably doing surgery and all those type of services came first. So we had people wearing rain slickers to protect them. We had people making masks. Gary Schultz is in the audience. His wife made masks for our staff because we couldn't get a hold of them. So we did everything we could to prepare our people, and they kept going and they kept serving because that's who they are. So it would be a disservice to just look aside and say, hey, it's okay if that program goes away like SUD did. But we have a history here with Kings County Behavioral Health that we have concerns about. And I want to start by explaining that we are here because KCBH signed a contract with Kingsview that was long negotiated, many, many months of going over the scope of work back and forth. While it appears that Dr. Lewis says that in February, she decided to write an RFP, we were still going back and forth and talking about scope of work, understanding that we had a contract, an unsigned contract, but a contract that we were working on. Now, we have done this for many, many years in Kings County. It has often gone on unsigned. That is not unique to this administration. But what is unique to this administration is in the past, those contracts were always honored. We were always paid. And as you know, these are cost reimbursed contracts. This is not fee for service. Kingsview is not making money or getting rich. We're there to serve people because we're passionate about it, and then we're reimbursed for what we spend. And that is combed over very carefully. And it's an expertise in-house that we have. We have amazing quality assurance, quality controls. We have amazing IT and knowledge about billing. That's actually a service we provide for many other counties in California. What's important is that we signed the contract, but in order to get it signed, and the reason we went this route is starting 3 years ago, the contract would be unsigned. We would work in good faith like we had always done. And then we had KCBH come to us and say, I'm sorry, we're going to cut $1.4 million. So when you talk about raising the services, what actually happened was they cut our money so much that we had to cut back on services. And we even asked them, you know, where do you want us to cut? And they said, that's up to you to decide. Then they would actually tell us what to cut in part. So we had to struggle. We had to lay off people. We had to reduce services. And when they told us you can decide what to cut, we were going to cut the wellness center. We were trying to kind of do a triage. Then they told us, no, you can't cut the wellness center.
Excuse me, if I may interrupt for a moment. I'm not certain whether or not the testimony you're providing is actually focused on the RFP.
It is.
I would ask you to keep it focused on the RFP and the process and the fairness of that process
And
is.
I would ask for the grace to be able to tell the story because there's a narrative and an important piece as to why we're here. It is not just about the RFP process being unfair and the fact that we really can't determine that because we weren't in their chambers at the decision table. It is the fact that it was put out to RFP after a contract was signed, only 1 month later. That is not fair. You do not put out an RFP process on a signed, agreed contract a month after it was signed without cause. Had we done something egregious, then that would be acceptable, and I would be happy to have that conversation. But we often solicited information from KCBH to say, how are we doing? What's working? What's not working? We had an executive meeting scheduled with KCBH executive team. Dr. Lewis was there once, and then those meetings after that, because we brought up the fact that we were unhappy about that money being cut. She said there are people in the community that do not want Kingsview here. And there are people that keep asking me, she said, and I quote, why are you still working with Kingsview? That was the last time I saw her in a meeting. And when I had that meeting with her, we basically expressed that we are always hoping to change, but she couldn't give us any feedback except that people didn't want us. And when we asked the specifics, she wouldn't give it. So when it comes to improving ourselves, we welcome feedback. We are happy to do anything. When I followed up again through email, she said she was very happy with our administration, Dr. Lisa Rogers, who is here, and her people that work with her, Nora and other staff that you've heard from today. She was very.
Dr. Nixon, can I interrupt you for a second, please?
Sure.
So what I'm hearing is your contention is there's a contractual maybe malfunction or malfeasance in the contract. And we are here to discuss the appeal of the RFP. And so I would encourage you to stay very tightly on the RFP. The unfortunate scenario of contracts is what it is, but that would be something that, you know, to go back and fix would probably have to be sought in a different manner. But I will follow up with County Council's encouragement to really focus on the RFP as it stands.
I hear you, Chair Peterson, and I appreciate that. What I can say, though, is the fact that it was put out to RFP a month after it was signed is important for us because we cannot say that in their deliberation process, because the same people were involved, that it was fair. And we're talking about an 8-point difference. So we're going to change children's services for an 8-point difference between us and MHS. And so we take issue with that because that does not seem fair. It feels to us like the goal was to take away the contract, as had happened over the last 2 years. Over $2.4 million to $2.7 million has been taken from Kingsview, reduced our ability to provide services. So in the RFP process, we decided to jump through the hoop, knowing full well that we would not get it because of what had transpired over the previous 3 years. And I know it is not a popular tale to say something's unfair, but as I said, when we have lost RFPs, that has been fine. This process is broken. As you know, we have been told, well, we can't give you any specifics because we haven't signed an agreement with a new provider. That is not common practice. Every time we apply for an RFP, we get that rubric to know what's going on. Lots of providers, some of our fellow providers that we're very close to, Turning Point included, has appealed many RFPs that they didn't get and were able to do so because they were given specifics about what failed in the RFP process. How can we appeal if we have no information except we didn't get it? I find fault with that part of the RFP process.
Well, I think it was clearly stated by behavioral health that process was followed and that there isn't a contract signed, and so legally, they're bound by not being able to release that information until such time. And
And respectfully, I disagree. That is not how it's done.
Okay.
There's no way to appeal an absence of information. How would anybody appeal? That's not how it's done. We have to have information to know where we failed so that we can say this is not accurate, so we can take issue and find where we fell short.
Okay, so again, testimony on the failure of the RFP, please.
Right. So the RFP failed in the fact that we were not given any information, any specifics. The rubric was not provided. Then we were told to say why we didn't, why we wanted to appeal. All we could say was we think it was an unfair process because of our history. That's why I'm talking about the history today. Then we were denied that in big, bold capital letters, denied. And then we were told we could appeal. And that's why we're here today is, again, I would be no CEO at all if I just walked away at this point when I know our history and with I know what my staff feel like and the work that they've done through this very unprecedented time that has been hard on everybody, not just Kingsview. So I can continue to go through other parts that are of issue to us. But again, since I don't have the rubric, I can't give you step by step of the process as to what we object to because it wasn't provided.
Yeah. Well, again, as I've said, I mean, if you have issues and have a contractual dispute, that's going to be, decided in a different place than here today. So again, just please, I get, the history and all that, but today we're here on the RFP and your appeal of that process, not of the history, not of the feelings, and which are all relevant. I'm sure many people are grateful for those services, but our boundaries today are the RFP appeal. So if you have further statements on that, would love to have them.
I do have further statements and I want to honor what you're asking for. And so I'll just repeat that I'm hobbled. I do not have the information KCBH has. I do not have any specifics as to why we were not awarded the RFP after providing these services since 1997. So can you see how I'm hobbled in this process as well? So the process from my perspective, the RFP process is broken all the way up into the appeal. All the way through the appeal, it's broken because I have no information. So how am I to appeal when I don't know how it was decided? That's a problem.
Well, I think it was explained in the testimony as well, how it was decided and the scoring was provided. But again, today, no contract has been signed. So at least in my opinion, from the testimony that's been provided, the information that's been released is that and would be counter to law, at least how it's been explained by behavioral health. I understand you're disputing that. So again, as much as you can focus on and provide your dispute. If you don't have any further, then we can move from there. But
Okay. No, I'm happy to provide further. You may have to tell me when I need to leave because I'm passionately committed to this. I will say I have wonderful staff who actually ran the program, who've been doing it a long time and can speak to the piece. Lots of what I heard Katie explain were things that Kingsview actually is doing and has been doing and does very well. However, when our budget was cut, again, the RFP process to talk about what's fair, being rated when your budget has been cut $2.7 million and told you're not doing this, let's bring in somebody who does it and pay them. That seems unfair, and that's a part of the RFP process. So you're comparing two providers and saying, well, they say and propose they're going to do it. An RFP is just that, it's a proposal. I can say I'm going to serve 8 million kids, and that sounds really good. And I can say I'm going to do this, this, and this, and MHS, and respectfully so, and I'm glad you are here. I would be too. So I totally commend you guys for coming. If I actually, we talked about the innovation we do. We actually have digital software. We have HIA. We have new things we're doing. We're actually using digital technology with kids. We're connecting them. We're using virtual reality to provide treatment and interaction. And it really appeals to kids because they are raised on digital technology. My PhD is in psychology with a focus in media and technology. I am using that expertise to help our kids in a way that is meaningful to them. So we are doing that at Kingsview. I mean, point by point, I can go through and talk about what we have been doing, what we are doing, and what we had planned to do to expand and to evolve in our services to the children here. But as people pointed out very astutely, it is a relationship. And quite frankly, and I know KCBH knows this, no matter what modality you use, no matter what treatment approach you use, the way kids get better is a relationship. There's research that shows that over and over again. It is about the relationship they have with their therapist, with their case manager, with their social worker. It is a therapeutic bond, a rapport where they feel regarded and cared for. That's how people get better. It doesn't matter if it's CBT, if it's play therapy, if it's sand tray, if it's art, it doesn't matter. It's the relationship. And that's what our staff have worked so hard to do for so long. Do any of you want to say anything? I've got expert. Okay, wonderful. This is my CFO, Mike Kosareff, a lot smarter than me on numbers, so thank you.
Good morning. Thank you for hearing us today. Now I'm going to get emotional. It is humbling that you are making time to hear us today. And thank you for that, first of all. So my name is Michael Kosareff. I'm a new member of the organization. I've only been with Kingsview for 11 months, but I'm a CPA and I got 34 years of financial experience, 16 of those in the healthcare not-for-profit realm. And with 10 years of audit experience, you can't wash that off. And so you can see that when there's issues, you can just automatically see it. So I'm going to start with first, when I was notified by 2 members of the behavioral health department that there was going to be an RFP. It was presented to me in a manner that we were losing financing. Okay? And I had to question that. And I said, well, it sounds like we're not even invited to respond to the RFP. Then there was backpedaling. Okay? But from what I can see as a new kid on the block, only months into this, that there was something suspicious in this process. And I understand the policy of the RFP process, but there's also a trustee relationship that the county has to the community. And when you decide to provide an RFP in the middle of a contract that would change at the beginning of a school year, even the finance guy knows that's wrong, because you're eliminating continuity of care. And that is unacceptable at every level. You don't, and what's really a problem here is that not only are we disregarding the care of the kids out there, but our employees who live and work in the county are losing trust in the county because they know they have a contract. Okay. And those that are sitting here today, listen to what HR was saying. They were saying 3% increase, 4% increase. Our budgets are getting smaller. We can't pay our people at fair market rates. And that's because Lisa Lewis has cut our budget $2.6 million in the same period that she's saying she's increasing spending. When they cut our budgets, they told us it's across the board. Everybody's losing money. I challenge you to look at the record and see if that's true. That says in God we trust, but the data, everybody else has to bring data and information. Our data records of our quality of care are excellent and they're ignored. And during the RFP process, during the oral presentation, there were no independent people there, only behavioral health. The decision was made before the RFP was put out. And that's the unacceptable part. The policy was followed, but the rest of the integrity of the county was thrown in the trash. I'm here to answer your questions. I can answer any questions that you have not. We have plenty of experts here. But this is wrong. No one does this in the middle of a contract. What does that speak to the integrity of your behavioral health department? We have people.
I've provided you some latitude to kind of to provide your input there, but again, I'll bring you back to the RFP process and the contractual a contractual dispute is not going to be handled here today. So
But
if
if
you
the
focus,
process is tainted,
please focus,
problem.
please focus on the RFP.
The RFP process was tainted. And that's
Okay.
a problem.
Okay. And we've heard you.
Thank you.
Again, thank you all. With a combination of heartbreak and sugar and caffeine, we are emotional and passionate, and I do apologize. We have every intention and have great respect for Kings County. That's why we want to be here and continue our work. We have a lot of Kings County residents, as you've heard. We care deeply about this county and about the people in it. So I just would ask for grace as we show up with a lot of emotion. It's been a really tough time for everybody. We have the layer of COVID on top of it. So we're just sort of raw. We're kind of like nerve endings walking around with shoes. Did anybody else, Lisa, would you, if we may, and I know you guys want to go home at some point, but if we could have Lisa, she runs the program. She's amazing. I'd love for you to hear from her. And she just had a little baby.
Well, if she has testimony to provide with respect to the RFP and how it failed, in your opinion, would love to have her testimony.
She does. She's a rule follower. Watch her.
I am. All right. Mr. Chairman, members of the board, thanks again for hearing us out on this process. So one thing that I did want to discuss.
Please provide your name for the record, please.
Lisa Rogers, Regional Director, of Kingsview. So about the process, something that struck our attention was, like Mike said, was the oral presentation process. We had that 9-point difference, and there was the oral presentation for clarification on the proposals. However, as Mike mentioned, there was no independent parties outside of Kings County Behavioral Health present at that. And as Dr. Lewis and Katie mentioned, that presentation was not scored. Therefore, I question what the purpose of the oral presentation was, if not to add scores or to adjust what was being considered when you asked for the oral presentation. If no scores were changed and questions were still answered, I question what what was the justification for the oral presentation if that wasn't going to be added to the overall score. Also, I was not present at that oral presentation, but it is my understanding that Dr. Lewis was not present in that presentation. And so it concerns me that decisions were made without the director or department head present for such an important decision. Thank you so much for listening to me.
My name is Beverly Rain, and I've been writing the RFPs for Kingsview for 11 years. When we received this RFP, it had contradictory things in it. We didn't understand if we could put everybody's resume in there or just some, if we could do some outcomes or other outcomes. It was the most poorly written RFP I've ever responded to. I feel that it was unfairly judged, where you have people in the Department of Behavioral Health who have on more than one occasion been hostile towards Kingsview. So I would definitely implore upon you to either A, reissue it and have it done all over again with a much clearer RFP, because the RFP was horrible. It was terribly confusing. We even amongst ourselves couldn't understand what we were trying to respond to. Also giving us clear indications of how we were scored and why. Thank you very much.
Thank you.
Thank you so much. Thank you for hearing us. What I would ask is if the board, I know you have 3 options, but if the board decides to put the RFP out again, if we are still having the same, and I say this as respectfully as I can, if we have the same people evaluate, we will be in the same position because of the history that we're sharing. That is our concern as well. So we ask for different people to be involved if that's how you want to do it. And again, we mean no disrespect to our competitor. We believe there's enough pie for everybody. Kingsview does not have to be the only provider here, but it was the way it was done. It was the process that we object to. And as I said, this is the only time we've ever appealed. Thank you so much for your time and the honor of listening to us and the honor of allowing my amazing staff to come in here. to talk with you. Thank you.
Okay, very good. Thank you. All right, we'll bring it back to County Council and then Behavioral Health. Any further comments, questions? Well, questions from the board.
You want a rebuttal from Behavioral Health?
Well, before we go there, are there any questions of King's view of the board, from the board?
That's it could be a tough one. I mean, yeah. I have no question.
Okay. Very good. So coming back to County Council and Behavioral Health, any further information?
I think according to the outline procedures, we would give Behavioral Health an opportunity to rebut, and then if there are any other further questions from the board, if not, we'll take it one step at a time. Let's start with that with the rebuttal.
All right, very good.
I'll just add that Kingsview is a valued partner. We still have a very large contract with them, which we are working together on. And we did everything we could to make this RFP process as fair as we possibly could. I was just going to ask Katie to go over again who was on the scoring panel. And just for clarification, the questions asked in the oral panel were just for clarification. There were some things that in the scores that they were just trying to clarify what did they mean when they said this. And we determined that they had answered the questions. So that was what that was about. And personally, I stayed out of this process intentionally. I knew that this is a very big decision in Kings County and just wanted to be as objective as we could be. It was a challenging process, no question.
Thanks, Dr. Lewis. Again, Katie Ernst with the Behavioral Health Department. I wanted to provide further clarification on, we had two separate panels. There was a scoring panel that reviewed and rated each of the three proposals based upon those 5 criteria. The scoring panel included a member of the Office of Education, Child Welfare Services, and 3 behavioral health program managers. There was a separate oral presentation, and the department sent out the set of questions to each of the proposers 2 days prior to that oral presentation. And the focus of those oral presentations was responses to those questions. The members of the panel for the oral presentation included 3 program managers and Chung and myself. We consulted with the purchasing office prior to making the determination of only having county staff present at that oral presentation, and that was supported by the purchasing office or the purchasing division. In addition, we chose not to score the oral presentation because there wasn't, in the actual RFP, was not specific scoring delineated for what that would look like should we have an oral presentation. So we focused on seeking clarification and not scoring the oral presentations because it wouldn't be transparent and that we hadn't already set out a scoring rubric for the oral presentations. Any questions about that for me? Sorry.
Not for me.
Thank you.
Chairman Peterson, if there's nothing further, then you would move to determine whether the board wants to decide this issue today or whether they'd like to take it under advisement.
Okay, very good. Thank you for that information. And with that, typically I think this is one of those issues where we're going to have to do some deliberations and take all the information under submission and would come back at a later date with a decision. I would imagine probably no later than 2 weeks, but I would take any input from the board if they have an opinion on how that may occur. But I think just to give everyone time to review the testimony that's been provided today and do so in a meaningful manner to respect everyone, that would be my suggestion. But I would be willing. Go ahead.
My question is the council, so we would discuss it today or next Tuesday? We have to put on the agenda for closed session?
We could put it on the agenda to discuss for next Tuesday.
Can't discuss it today at all until put it on the agenda, identify it, correct?
In order to be safe, in order to take a conservative approach, I would recommend that we put it on the agenda for closed session for next week.
Come back in 2 weeks and then make a decision at that
Yes.
point. Okay, I'll make a motion to go ahead and I guess basically put it off until further notice. We'll discuss, put on closed session next week, and then we'll give an answer for both sides in 14 days. Okay.
Nev seconds that by adding the 21st as the closed session item under the deliberations and delivering the response on the 28th.
Okay, very good. Any further comments? Hearing none, Madam Clerk, would you please call the roll?
Joe Nevs,
Yes.
Doug Verboon,
Yes.
Craig Peterson,
Aye.
Richard Fagundes.
Yes.
Okay, we have 4 in favor, 1 absent, and motion carries. Thanks to everyone for your heartfelt testimony. We appreciate all the services past and those that will come in the future, and certainly value all of that. So with that, thank you for that. Okay, we'll move to item 7, which is board member comments at this time. So Supervisor Rubus.
Yeah, we'll take about 3-minute recess while everybody disperses from the audience.
Okay, let's do that. And we'll be back at 12:22 or so. All right, are everybody sufficiently ready to roll again?
Another couple of minutes.
The important people are here.
Yeah.
We have no CAO or council, but
Okay.
good.
And one board member.
Well, you can't hear him anyway. If the chairman's ready, we can go ahead and start with those that are present.
Okey doke. We'll go ahead and go back to board member announcements.
Hey, thank you, Supervisor, for being here. And so yesterday I attended the Valley Voice trip to Washington DC via Zoom. We talked to White House staff, and we also talked to Senator Padilla's office and his staff members, and also Congressman Costa's staff members, mainly on funding for Highway 99 and water infrastructure. Also attended the Sheriff Posse dinner on Saturday night. Had a large crowd there, a good event. And also attended the Salute to Ag dinner, which we've recognized Steve Walker and the Sheriff's Rural Crime Task Force. Also got an award for being Ag Sport of the Year. And that event was very well attended as well. So that's all I have. Thank you very much.
Good, thanks. Supervisor Neves.
Thank you, Mr. Chair. This report goes back 2 weeks. Attended the Housing Authority that had a few food distribution as well as COVID testing and immunization. That was on September 1st. Congressman Valadeo, as well as Clerk and Mayor Patricia Nolan were in attendance, and a lot of food was given out, and Calviva sponsored the event by having bottled water. Then traveled to Fresno for a Calviva public policy meeting. Received all of the educational outreach. As with the pandemic, a lot of that outreach has been significantly scaled back, and a lot of the in-person stuff is not being held at this time. So a lot of those impacted areas were not being addressed, but we are working on activities to improve that outreach through virtual media. We also approved the 2022 meeting calendar and shared information about the medical services changing in 2022. The prescription service that has had the last 18 months of transition into the state to a whole person care type integration of mental health and physical health, along with case management. And then there's going to be an additional organ transplants for managed care starting in 2022. So I think many of the people won't see the differences. The cards will probably be the same. The places where they get their meds will probably remain the same, but there will be some changes in behind the scenes on payments and the way the bids are taken for medications. King's Waste and Recycling is conducting interviews for a discussion to return to private operations. King's Waste and Recycling, when it was developed in the year early 90s, was under private operation. And after a lot of consideration, went to the current model. And now the organization is looking at reverting back to that. So we're going through those options today, and they have been for the last couple of weeks. The State Controller's Office meeting, we continue to discuss excess proceeds. Cannabis continues to keep giving everybody a real high. Transit occupancy, as well as tax collections on manuals and webinars, and not having conferences, and with staffing changeovers and everything else. So we continue to try to do outreach through webinars and virtual modes. There was also a big discussion on major disasters. And many of the large fires have created not only problems in air quality, people losing homes, but there's also a law in the books that says that individual has 5 years to build that structure back. Unfortunately, because of permitting, COVID, the availability of contractors, the availability of architects. Many of those 5-year periods are not being met in that 60-month period. So there's discussion about taking that and extending that out, not just for fires, but for earthquakes, floods, beyond that 5-year limitation. So be thinking about that and talking about that as you go through some of your discussions. It's one thing when one house burns or maybe 2 or 3 houses in a neighborhood, but some of these areas, there's 15,000 structures being destroyed. And so if you can imagine the workforce to build back that whole community just is very, very time consuming. A lot of the zoning, a lot of the infrastructure has to be rebuilt, and it just takes much more time than the 5 years that have been on the books. Continue to announce football at Lemoore High and as well as the Lemoore Raceway. Very nice turnouts on Friday and Saturday at both of those events. Certainly want to thank Lemoore Fire, Kings County Fire, who brought out the ladder trucks. Lemoore Police Department, the County Sheriff, as well as American Ambulance for their attendance. Both of those events had military and first responder appreciations and even had a flyover. So it worked out very, very well. And then the Kings Federal Credit Union audit report was given last night. Even with all the trends of COVID, people are saving more money. They're not spending as much. We figure those trends might change when the economy opens up. If you've been in the market for a new car, you probably can't find one. And so there is probably a lot of pent up spending out there that will probably occur. But right now, it sure makes all the trend lines look very, very good for the credit union. Enrollment was up 3%. So, you know, it's good and bad, but all the trend lines were mainly going in the right direction. So with that, thank you, Mr. Chair.
Thank you. Supervisor Fagundes.
He said he's good.
Thank you. Well, I'll just follow up on Supervisor Verboon's comments that, you know, did attend the Agriculturist of the Year Awards with Steve Walker being recognized as the Agriculturist of the Year, and also the Deputy Sheriff's Association, along with the Road Crimes Task Force. Was received really well. I think everybody's really appreciative of everything that you know, DSA and Road Crimes Task Force has to deal with, and especially in these challenging times with you know, just opinions and you know, everybody's kind of on the edge, and it's a tough time to be in law enforcement. And so that was just really received well, and congratulations to the, you know, Greater Kings County Chamber of Commerce for putting on another great event, and first time for their new CAO, and be a few things that we need to kind of upgrade and fulfill, but for the most part was well done. And then just following up on Supervisor Nebbs's comments with respect to the challenge of finding contractors and, you know, just getting parts, whether you're looking for a part for a pickup or you know, building a house, it's a challenge right now, and so I can imagine those timelines are really challenging. But with that, we'll move to board correspondence.
Thank you, Mr. Chair. We have no board correspondence to report this week. As far as upcoming meetings and events, the Hanford Planning Commission notice of public hearing regarding Hanford Island annexations and pre-zoning on September 14th at 5:30 p.m. in the council chambers of the Civic Auditorium. Have groundbreaking ceremony as presented earlier by our Chief Probation Officer for SB 81 Round 2, Juvenile Facility and Day Reporting Center, September 15th at 1:30. We have the Public Safety Luncheon on September 24th at the Hanford Civic at 11. We have American Legion Post 100 Lemoore and the City of Lemoore President's Gold Star and Fallen Heroes Family Memorial Tree Ceremony at Lemoore Veterans Park on Sunday, September 26th at 2 p.m. Links for Life Pink Passion Picnic at Hanford Civic Auditorium, October 20th, 2021 at 10:30. far as upcoming agenda items, behavioral health has the service agreements with Plumlee's Board and Care for adult residential care services. Public Health, of course, has the COVID-19 update. They're also bringing a flu administration fee waiver for their vaccine clinics next week. And Child Support, they have a plan of cooperation between Kings County Superior Court and the Department of Child Support Services. Those are all that are on the agenda items so far. It's going to be a short agenda, it appears.
Okay, very good. Thank you. Next up, we'll move to item 8, which is closed session. We have a number of items on closed session today. Some information with respect to that. First, we have a conference with real property negotiator, two cases, Government Code Section 54956.8. Secondly, we have significant exposure to litigation, one case, Government Code Section 54956.9 D2. We have another significant exposure to litigation, two cases, Government Code Section 54956.9 D2 and E3. We have a personnel matter, Government Code Section 54957, Public Employee Appointment, County Council. We have a personnel matter, Government Code Section 54957, Public Employee Appointment, Director of Finance. And then finally, conference with labor negotiator, meet and confer, Government Code Section 54957.6. That will include CLOSIA General, CLOSIA Supervisors, SEIU Blue Collar, Probation Officers Association, Firefighters Association, Detentions Deputy Association, Prosecutors Association, Deputy Sheriff's Association, and unrepresented management. So with that, we have reached the end of our regularly scheduled meeting. Is there any other information to come before the meeting this time? Hearing none, we will adjourn to closed session and be back with you on Tuesday, September 21st, 2021 at 9 a.m. Thank you.
Anyway.